Bayer is not a small organization, but we are growing. And this also, in many ways, was our first foray into the social media world. Digital media is a powerful marketing and communications tool. But really, as we've, I think, seen through a lot of the discussions today, it's really a means to an end. And it needs to be built on a foundation, a strategic foundation, that is strong and makes a lot of sense. We value our partnership with WomenHeart because our aligned goals, our common goals, are that foundation, and it gives us the opportunity to get our message out and now to do a foray here into this whole social media world. Let's talk about the program. The program had two goals. First was to move women who are at the risk of heart disease, and there are many, many of them out there, from a position of complacency, which really is actually very common, as I'm sure many of you have experienced, with people who are at risk for chronic disease, to a point of action. And specifically, what we wanted them to do is to engage with their physician, engage and talk and learn about their risk factors, as well as to understand and engage as to whether an aspirin regimen, among other treatments, may be appropriate for them. And then secondly, we were looking to raise the awareness of aspirin as a lifesaver, both for its role as to protect and save a life if taken during a suspected heart attack, but also for its longer-term cardiovascular prevention benefits. And we had two messengers. Sandra Tremulis is a WomenHeart champion. She's a member, and she is a patient advocate with a great story. Kathy Berra, who is a former president of the Preventive Cardiovascular Nurses Association. She is really a true key opinion leader and really one of the leaders in the area of women's cardiovascular health. Okay, so why do we go after social media? What was the impetus there? Well, first of all, our target was online. I was very surprised to find out that the fastest growing segment on Facebook is the population of women aged 55 to 65. So clearly, they can be reached here. Secondly, there's also a huge number of blogs out there, maybe 2,000 plus blogs on the topic of heart disease and cardiovascular disease. Clearly, this is a place that people are looking for this kind of information. Secondly, we wanted to create and spark some organic conversation around this. For years, Bayer has been advertising to both men and women and getting a message out there about risk factors, about understanding your risk factors. But really, there's a whole nother level of engagement when you're actually having a conversation and talking about what to do about it and what you can do about it. And then finally, from a more practical aspect, Heart Month was coming. It was February, and that's the month when the media outlets and everybody starts focusing on cardiovascular health, and we needed a program to get out there to really take advantage of that. So we looked at this as an option. Okay, what did we do? Well, our approach was to create a Facebook fan page. We've heard a lot about some of those, and it was a very successful foray for us. Had a number of different elements. First, a risk assessment tool where people could actually assess whether they were at risk or not. It had a podcast, a video podcast with Sandra Tremulis and her story, and really about how you can be an advocate for your own health. It had a question and answer guide for how to engage with your healthcare professional about whether aspirin was right for you and and whether it was something that you should be using and how you should use it. We had a place where people could post their stories, and believe me, on the years I've worked on the aspirin business, there are just many, many of them out there, and most of them will move you to tears or really scare the heck out of you and get you into action, or usually both. And these are some really terrific stories we heard from people who wrote in. And then finally, and probably this is the linchpin to the program, we had an initiative that was really sparked by Sandra's story. Sandra is 39 years, or had her first heart attack, or had a heart attack when she was 39 years old, and she almost died from that. She was on a routine business trip. She had taken some aspirin for pain. She actually hadn't been feeling well for a long time, and she felt like something was up. It had gone to the doctor, but she was really healthy. She was fit. She was a fitness instructor, and the doctors felt she was okay. But her intuition told her something differently. And so when she came back from this trip, she met with a specialist, and she found out that she had almost no blood flow to the left side of her heart. And as a result, the doctors immediately took action. And one of the things they told her was that the aspirin that she had taken probably saved her life. So after this, she was very moved by the whole experience. She not only was she on an aspirin regimen, but she also had devised a little device, a carrying case, to take with her to be able to carry aspirin with her wherever she was. So we modeled a similar heart-safe program off of that. And that became an important part of our program. Well, we got the message out in a whole bunch of different ways. We basically we started out with an advertorial, sort of, with TNT, where Sandra got to tell her story. It was supported by Bayer, but produced by TNT. We had some traditional media outreach on online and offline media, as well as a number of newsletters, electronic newsletters, through Bayer, through WomenHeart, through eDiets, through Better Homes and Gardens, and ways to get that message out. There were about 250,000 direct hits and about well over 200 million media impressions in terms of getting that message out directly to the patients. As a result, I mean, basically, we had very, very strong results. In the first week, we had over 6,500 fans, new fans. Within the first 4 weeks, we had well over 13,000. Just for perspective, the American Heart Association at the time had about 9,000 to 10,000. So we really struck a chord with this. We had over 65,000 requests for that heart safe. And also at the time, while there were a lot of other things going on, Bayer Aspirin, it's a 110-year-old brand, actually reached its highest retail sales level as it has in years. So there was a huge, huge amount of discussion and conversation out there. One of the interesting things is that on this webpage, there were conversations about, there were people telling the story about how to get this heart safe. In fact, there were blogs all over the place that spoke and pointed to this website as the place to go for this heart safe. They had heard the message on TV, they had heard it in the press, and they had read about it online. So all unprompted, they were talking about it and driving people to the site. I think when you think about what is the most compelling and what drove the success of this program, is the combination of the traditional and the online media, social media. Social media and digital media is terrific when you have a targeted audience and you really want to engage in a very close conversation. But nothing will get you eyeballs like traditional media. And I think the synergy between those two is really the key. How do you get the message out, drive people in, and then get the conversation to happen? Other key to success here is that we gave people something that they could use. We gave them information, we gave them a message, we gave them something that inspired them to actually take action. One of the other interesting things that had happened is, over the following months, many of my colleagues actually had gotten this viral email that's been going around about saying, you know what? Tell your friends and family, you got to have a bottle of aspirin next to your bed in case you're having a heart attack. So tell as many people as you can, pass this along to however many people. I don't know where this thing started. It certainly didn't start with us, but it started with somebody who got inspired by this message or a related message that basically made them take action. And that's what social media is all about, and that's when you know you've got something that's working. So in the end, I think the most important thing here is that we were able to bring to life an important partnership, two organizations with common goals to help public health, to really address a public health issue and a public health goal, as well as doing a good thing for our business. So together, those things were very important. As we look forward, we're looking at ways to build on top of this, to really build on it, build the community that we've taken and that we've created, and keep the excitement going, keep the energy going. Again, it is our first foray here, so I think there's an opportunity for us to keep that going and finding new ways to engage this audience. Thank you.